お二人目の先生はですね、シュニール・プルジェビッチ先生です。アジア諸国における薬物使用パターン、世界薬物使用調査というタイトルでお話をいただきます。先生のご紹介を、カルメン先生からお願いしたいと思います。
So, Dr. Cheneal Puljevic is a senior research fellow at the National Health Medical Research Center of Research Excellence on Achieving the Tobacco Endgame at the School of Public Health at the University of Queensland. She is funded by a Discovery Early Career Researcher Fellowship from the Australian Research Council. Her current research interests focus on the drivers and deterrence of illicit tobacco use. Her other research interests include smoking cessation among disadvantaged population, drug checking, and substance use harm reduction. Cheneal is a core research team member for the Global Drug Survey, associate editor for the International Journal of Drug Policy, a deputy editor for Drug and Alcohol Review, and the Queensland research lead for the Loop Australia. And over to you, Cheneal.
Good morning, everybody. Thank you so much for having me. It is an honor to be here today. It is my first time in Japan, and we've only been here for 2 days, but I love it so far. So thank you all very much for having me. Today, I'm going to be speaking to you about patterns of drug use in Southeast and East Asian countries from the Global Drug Survey. And then I will speak about some of Australia's harm reduction services. So here's a brief overview of what I will be speaking about. I will quickly tell you a bit about myself and our research center. I will then talk about the background and the methods of the Global Drug Survey. I will then talk about how some of the Global Drug Survey data is used. For example, there's a few apps that have been developed. I will then provide some results from our 2020, 2021, and 2022 surveys among respondents from a few countries in Asia. I'll talk about the drug use in the past 12 months and patterns of cannabis use, and then the overview of Australia's harm reduction services. And if I have time, I don't think I will, but if I have time, I'll talk about some of the interesting data we have from the Global Drug Survey about people who mix tobacco and cannabis. So just quickly, a little bit about me. I'm originally from South Africa. So I completed my honors degree in psychology at the University of Cape Town. I then moved to Australia for my PhD, and I did my PhD at Griffith Criminology Institute in Brisbane. My thesis was about smoke-free policies in prisons. And since then, I have been employed at the University of Queensland. First, I worked with Professor Jason Ferris. He is the chief biostatistician for the Global Drug Survey. So we worked on various projects related to illicit drug use. I then moved to the center where I am now, and I was the research operations manager for 2 years. And then since 2022, I've been in my current role where I am a senior research fellow focusing on Australia's illicit tobacco market. In 2024, I led the Global Drug Survey. I also want to mention that I'm the Queensland research lead for the Loop Australia, which runs Queensland and Victoria's first ever drug checking service. And I'll talk about that at the end, so you'll understand more about what that's about. So our research center focuses on tobacco cessation, and more specifically, the tobacco endgame, which is about ending tobacco use completely. So our research center aims to build the evidence base for tobacco endgame strategies to find out which strategies have the most potential to end tobacco use. And our work is funded by the Australian government through the National Health and Medical Research Council and the University of Queensland. So now I will talk about the Global Drug Survey. The Global Drug Survey is an annual cross-sectional online survey of drug use. It was founded in 2011 by Professor Adam Winstock, who is at the University College London. And on the right of the slide, I show the other core research team members, Dr. Monica Barrett from Melbourne, Professor Jason Ferris, who is also at the University of Queensland, Dr. Emma Davies, who is at Oxford Brookes University, and then myself. The mission of the Global Drug Survey is to make drug use safer, regardless of the legal status of the drug, and to share that information with individuals, communities, health and policy organizations. Our research findings are shared with the community through journal articles, media articles, apps, and commissioned reports. The Global Drug Survey has been running annually every year between 2013 and 2024. There was no survey in 2023, and there will be no survey this year. But we're hoping that in the future, instead of a normal survey, people will be able to enter their information about their drug use, and then they will see the results in an interactive dashboard, which will compare their drug use to the drug use of all other people who respond to the survey. We're currently building that at the moment. And then we ran an extra survey in 2020 to capture patterns of drug use during the COVID-19 pandemic. The Global Drug Survey has attracted very large international samples. So our biggest year, for example, was 2019, where 123,000 people did the survey, then 113,000 in 2020. We then saw a decline, 32,000 in 2021 and 55,000 in 2022. We had quite a small sample in 2024. There were only about 13,000 respondents. And that's why we realized that people are getting tired of surveys. So maybe it's time to change our approach and rather consider this interactive dashboard that we're building. Because of these large numbers of people who have done the survey, we are able to call ourselves the world's largest online drug survey. Now I'll talk about the methods of the survey. To recruit participants, the survey is very widely promoted by international media and research partners through social media posts and through media articles. So for example, we have some connections at some newspapers and they promote the survey for us. And then when the results are ready, we share the results with them and they have exclusive access to publish those results. That has been quite an effective strategy for a number of years, but unfortunately, there seems to be a lot less interest from the media these days. The survey usually runs between November and February, but the last survey ran from January until April. The survey items are developed by all the core research team members and our colleagues who are experts in other topics. To take part in the survey, people must be aged 16 or over, and they must have used at least one drug in the last year, and that can include legal drugs like alcohol or tobacco. The survey is usually translated into 9 other languages: German, Danish, Dutch, French, Hungarian, Italian, Portuguese, Romanian, and Spanish. And hopefully in the future, we can translate it into other languages like Japanese, and that will help us to increase the number of people from Asia who take part in these surveys. The survey received ethical approval from University College London every year until 2023. And then when I ran the survey in 2024, we got ethics approval from the University of Queensland. It's very important for me to be clear about the limitations of the survey. It is a cross-sectional convenience sample. Of course, there is an overrepresentation of people who use drugs and who have access to the internet. So that means that these data are not representative. So we can't talk about prevalence, but we can compare people between countries. On the Global Drug Survey website, there's a list of all of the academic articles that have been published using Global Drug Survey data. So that's just an example there from 2023. So if you're interested in any other findings from these data, then please have a look at the website. I also wanted to show you an example of some of the media articles that have come from the survey. So for example, here is a newspaper article from USA Today, where we found that some people are able to get cocaine delivered to their house faster than pizza. So that, of course, got a lot of media attention. There's another one from The Guardian in Australia, where many Australians say they are drinking too much and want help. Another one from Changing America, where the Global Drug Survey finds the drunkest country in the world, and it's not the US. It turns out it was actually Australia. And then this one from Vice, which is a big international media house, that women regret drunkenness more than men. So these are the kind of interesting headlines that the media usually picks up from our data, and that helps us to get attention and therefore recruit more people. Here are the harm reduction resources that have been developed using the Global Drug Survey data. I'll talk about each of these now. This is also on the website if you want to find out more. So the first one is called Drinks Meter, which is a web and smartphone app that helps to give personalized feedback on drinking. So people fill in a short survey about their alcohol use and their medical history, and the app then gives them personalized feedback on their drinking and how their drinking compares to other people. 94% of people said they would recommend the app, and you can download it from iTunes or Google Play Store, or look at the Drinks Meter website if you want to find out more. Then, just like Drinks Meter, there is Drugs Meter, which is exactly the same thing except for drugs. And people can see how their drug use compares to other people, and it gives them personalized feedback about how to reduce harms from drugs. Next is the Highway Code, which is essentially guides to harm reduction for various drugs. So you can see there's ones for alcohol, cannabis, MDMA, and so on. These guides were developed on information from people who took part in the Global Drug Survey 2014. And these are PDFs that you can download from the website. Next is called One Too Many. This is a short survey targeted to young people aged between 20 and 25 years old. And it helps them to look at whether alcohol turns them into someone they'd rather not be. So does alcohol use change their behavior and their personality? So it helps them to reflect on their alcohol use. Next is Safer Use Limits, which is also a guide to safer drug use based on data from 100,000 people who took part in the 2015 survey. Currently, there are only guidelines for cannabis, but the rest are coming soon. So it asks you how often you use cannabis and how much you usually use on a typical day. And then it gives you a risk score based on your answers. So here's somebody who said that they use a small amount of cannabis every day, and they are considered a high risk for cannabis dependence and other harms. And then finally, this is the newest product from the Global Drug Survey. This is called Staying Safe. Professor Adam Winstock has developed this. This is a series of educational modules aimed at university students to help reduce harms from various drugs. So, for example, you can see on the website, there's a module on sexual safety, but in total, there are 42 modules. So a module on every drug you can imagine, and then a few other relevant ones for students to help reduce harms that students experience. So this is a package that universities can buy to distribute to their students. But if you have a look at the website, there are a few free modules that you can have a look at. Each module is a short video with experts on the topic talking about how to reduce harms associated with various drugs. Okay, so now I will talk about results from the Global Drug Survey, 3 years of data the results from Southeast and East Asia. So here are the sample sizes that I'll be speaking about. So unfortunately, these are a bit low compared to other countries, but I'm hoping that you still find it useful to compare drug use between countries. So we've included China, Hong Kong, Indonesia, Japan, South Korea, Malaysia, Philippines, Singapore, Taiwan, Thailand, and Vietnam. And you can see of all of those, Japan had the most respondents. So 18.3% of the sample was from Japan. And then the other countries with more people were China and Thailand. So this is just keep these numbers in mind when I present the next results. So this is the age of the respondents for each year. So you can see 2020 had a median age of 29, then 37.5 years old the next year, and 43 years old the next year. So I don't know what happened, but over time, seems like a lot older people took part in the survey. And then gender, so about 3/4 of the respondents are men, and 21% were women or female, and then the rest said that they were a different gender. In terms of the highest qualification of the respondents, you can see that the majority of them have an undergraduate or postgraduate degree. This just shows us that the sample is quite highly educated, and this breaks the stigma, the perception that people who use drugs are uneducated. Here we can see that most people are very highly educated who do the survey. All right, so now I'll go through the drugs one by one to show you how many people report use of that drug in the past year. So starting with alcohol, of course, this is the most commonly consumed drug by all global drug respondents, not just those from Asia. Almost every country, there's about 90% of people who say they've used alcohol in the past year. I also wanted to look at risky alcohol use. So this is the number of people who report that they drink 6 or more alcoholic drinks each week. The most common in Thailand, but yes, there are quite a few people who report drinking alcohol very frequently. Then is amphetamine. So here we can see that people from Malaysia and Vietnam were most likely to report amphetamine use. Next is benzodiazepines, which I think you all know is a sedative drugs often used medically to treat anxiety or insomnia and seizures. They help to calm people down. So benzodiazepine use was highest in Indonesia and Vietnam, and it was quite low in Japan. Next is cocaine. I think we all know that cocaine is a stimulant. It's a white powder or a crystal form, and it gives people an energizing and euphoric effect. So here we can see that, again, Indonesia was quite high, so was Vietnam, and we had just over 10% of the Japanese respondents said that they used cocaine in the last year. MDMA, also known as ecstasy. These can be colorful pills or a white powder. It's also known for its euphoric, empathic, and stimulating effects. So this was quite high compared to other countries. And we have the same situation in Australia. MDMA is quite a common drug, especially for young people when they go out to clubs or festivals or they're partying. So again, Indonesia was quite high, Taiwan and Vietnam, and we can see just under 20% of Japanese respondents report MDMA use in the past year. Then for heroin, because the numbers are so small, I'm rather reporting people who have ever used heroin rather than just in the last year. So heroin is definitely one of the most risky drugs. So there was nobody from Japan who reported heroin use, but you can see there are a few people from other countries, especially Taiwan and Thailand, who said that they have used heroin. Next, we have ketamine. So ketamine is usually used as an anesthetic or pain relief. It can be a white powder or a clear liquid. We are seeing a quite an increase in recreational ketamine use in Australia because people find that if you are careful with how much you use, the effects only last for a short time, about an hour, and then afterwards you feel completely fine to drive. You have no hangover the next day. So ketamine is really becoming popular as a party drug in Australia. So here we can see that people in Vietnam were most likely to report ketamine use, and they were probably about 7% of people from Japan that they had tried ketamine. Then we have LSD, which is a hallucinogenic drug that alters perception, mood, and cognition. LSD is usually, it looks like a small square piece of paper with a little colorful picture on it. So people from all the countries did report LSD in the past year. So we can see about 20% of the Japanese people, they've tried LSD in the last year, and this was most common in Taiwan. Then methamphetamine. So I know that this is the most commonly used illicit drug in Japan. We can see that methamphetamine use was most commonly reported in Malaysia and South Korea, and there were quite small numbers in Japan, which I found interesting. Then we have prescription opioids. So this is opioids usually prescribed for pain relief. They usually come as tablets or pills. These are usually the most common cause of drug-related overdose. I know in Australia, the majority of drug overdoses is from prescription opioids. So by far the most common in South Korea, and we can see between 10 and 15% of the Japanese respondents report using prescription opioids in the last year. But we don't know whether these people were actually prescribed the opioids or not, or whether they're using them illegally. Then we asked people if they have ever bought drugs from the dark net. For those who are not familiar with the dark net, it's a part of the internet that you can't usually access via normal search engines. So you need to download a special browser like Tor to access it. It offers privacy and anonymity, which can be used mostly for illegal activities like buying drugs or guns or things like that. It operates separately from normal websites and can be quite difficult to access. But at least in Australia, for example, a lot of people do report buying drugs from the darknet because it is usually an anonymous way of buying drugs, and they get delivered to you in your postbox. So I also added stars at the bottom to show which countries have a death penalty for importing drugs. So I find it very interesting that these people have bought drugs from the darknet, considering the very serious possible implications of doing so. So we had, especially in Malaysia, nearly 25% of people from Malaysia said that they have bought drugs from the darknet, and just over 10% of people from Japan said that they have bought drugs from the darknet. All right, so now I'll move on to cannabis and the data that we have about cannabis use in people from these countries in Asia. So compared to the other drugs, the reported cannabis use was quite a lot higher. So you can see in Japan, just under 30% of the respondents said that they have used cannabis in the last year. But if you look at countries like Philippines and Vietnam, there's about 60% of those respondents who said that they have used cannabis in the past year. So it's certainly the most commonly used among these respondents. We then asked people, where do they usually buy their cannabis from, or where do they usually get their cannabis from? And I looked at the most common response in each country. So in Japan, people said that they most commonly get cannabis from a dealer that they know or a friend. And that was common for most other countries. In Cambodia, people said they most commonly get their cannabis from a shop, which I find interesting. And then a few countries where people are most likely to get it from friends. People were then asked if they use cannabis medically or recreationally. And so the blue shows the number of people who report using cannabis for medical reasons, and the orange shows people who use it recreationally. So in every country, we can see that it is most commonly used recreationally, but there are a few countries where people are reporting using it medically. So if we look at Japan, we had about 20% of people who said that they used it medically, and the rest said they use it for recreational purposes. South Korea and Thailand are the two countries there where cannabis is available medically, but for some reason, nobody from South Korea answered this question. We then asked, what is the most common route of administration for cannabis? So how do people use their cannabis? So we'll start with Japan. About half said that they smoke it in a joint. At the top picture, that's the most common way of using cannabis. Then there were about 23% who said they use it in a pipe, and 27% who said they use it in a vape pen. So I understand that you can get CBD vape pens or electronic cigarettes in Japan. We saw them yesterday in a shop. So I wonder if these people are answering about CBD vapes rather than THC vapes. Then if we look at the other countries, almost all of them, the most common route was joints. In the Philippines, there were a few people who said that they most commonly use it as edibles. So that's the picture at the bottom. So like gummies or chocolate or that kind of thing. Then we asked people about the most common form that they use. So what kind of cannabis are they most likely to use? And this is the actual question that people see when they do the survey. So we include pictures to help people to understand the differences between all the different forms. I want to just quickly mention resin or hash. The second picture you can see. So resin or hash is a concentrated form of cannabis made by extracting the resin from the plant. And it's usually a brown, sticky substance. It's very concentrated and very high in THC. So that's why people prefer using it. So if we look at the results then, if we'll start with Japan. So, I also wanted to mention, we've got a normal weed on the right. So that's just kind of, if you grew the plant in your garden, that would just be normal bush weed. Then on the left, there's the high potency cannabis. So Wayne mentioned earlier that companies are producing this very high quality, very potent cannabis. It's very concentrated flowers. So that's the difference between the two. So if we look at Japan, we had 85% who said that they were using bushweed, so just normal cannabis. And then the others said that they were using the high potency herbal cannabis. The other countries are also quite similar. In Taiwan, everyone was reported using concentrates. So that's various kinds of like oil, very concentrated forms of cannabis. What else? Yeah, the others were all Singapore, some people also said concentrates, and Philippines, there were some people who said edibles. We then asked people if they would like help to use less cannabis. And you can see about 17% of people who from Japan said that they would like help to use less cannabis. This was most common among people from Hong Kong, about 40%. So you'll notice here that this is still the minority of people. So that means that most of the people who are using cannabis don't want help to use less. They feel fine about how much cannabis they are using. We then asked people whether they add tobacco to their cannabis joint. And this is a area of interest for me for my research, because tobacco is so very harmful, but the emerging evidence is saying that cannabis is a lot less harmful. So from a harm reduction perspective, it's much better for people to use joints that are 100% cannabis and not add tobacco. A lot of the health harms that come from using cannabis is from adding tobacco to the joints. So we are currently working on a paper looking at these results in more detail and looking at how we can get people to stop adding tobacco to their cannabis. So you can see 100% of people from Taiwan said that they add tobacco to their cannabis. And in Japan, it was about 35% of people. So I find this very interesting, and hopefully with time we will help people to understand the relative harms of these substances to reduce their tobacco use in particular. So that's the end of those results, but I just wanted to quickly show you the Global Drug Survey website. So if you go onto the website, you can see there's links to all sorts of things, previous surveys, past findings, the list to all the academic articles. There's links to all the apps that I mentioned, and then a few other reports with some interesting results. So for example, so for example, in 2020, there was a special module on psychedelics that you might find interesting. Okay, so now I will talk about harm reduction services in Australia. So I'm sure that you're all familiar with the concept of harm reduction, but just in case anybody isn't, harm reduction is about reducing the harms from drug use. So not all people are ready or able to stop drug use. So rather than trying to continually force people to stop drug use, we rather try to reduce the harms from drug use, particularly harms like overdoses and diseases, like blood-borne diseases. So these are services that don't try to stop people from using drugs, but rather try to make it less risky for them. It's also important to mention that Australia is obviously, the drug policy context is very different to Japan. In our last National Drug Strategy Household Survey, just under half of Australians said that they have ever used an illicit drug, and about a quarter have used an illicit drug in the past year. So illicit drug use is much more common in Australia. And so that's why it's very important that we have harm reduction services for all the people who continue to use drugs but don't want to or can't stop using drugs. So these are the services I'm going to be telling you about. There's 6 of them: needle and syringe programs, supervised injecting centers, drug checking services, opioid agonist treatment, naloxone, and peer services. All right, so to start with needle and syringe programs, these are services that provide people with free access to sterile injecting equipment like needles, and gives them an opportunity to dispose of their used needles in a safe way. The main purpose of needle and syringe programs is to reduce the spread of blood-borne diseases like HIV and hepatitis C. There are over 800 needle and syringe programs across Australia. These are based at community health centers, pharmacies, and outreach services. So the point is to make them as widespread and accessible as possible. The studies, there's a study there that I've referenced at the bottom. They estimate that needle and syringe programs have saved over $1 billion in healthcare costs, reduced HIV incidence by between 34 and 70%, and reduced hepatitis C incidence by between 15 and 43%. So these really are very effective programs in terms of reducing the harms of drug use. Next, we have supervised injecting centers. These are quite controversial. Even in Australia, there's only 2. There's one in Sydney and one in Melbourne. So these are facilities where people can inject their drugs under medical supervision. And the aim of these services is to reduce overdose and deaths and provide pathways to treatment and support. So often it can be quite difficult to reach people who use drugs, especially people who inject drugs. So like this, people are able to come in, they have a safe place to inject their drugs. There's medical services on site in case they overdose. And you can also then talk to them and find out how they are and if they need anything, if you refer them to treatment or hospital or anything else. So as I said, there's one in Sydney, the Sydney Medically Supervised Injecting Centre, that has been operating since 2001. And then there's the North Richmond Community Health Injecting Room in Melbourne. There's a lot of controversy around these services. So for example, people in Richmond in Melbourne really don't like having the service there because obviously it brings people who inject drugs into their community. But luckily, the evidence shows that these are effective. So they are staying in place, and people are currently fighting for a second injecting room in the centre of Melbourne. If we look at the studies that have assessed the effectiveness of these services, I've included references at the bottom. Sorry, they're quite small. The outcomes. So firstly, this study by Salmon and colleagues found that there was a significant reduction in ambulance attendances for opioid-related overdoses when you compare before and after the Sydney service opened. And they found there was no impact on crime. So that's a good thing. It means that there was no increase in crime, and that there were also no changes in drug use or drug supply offences at the Melbourne Centre. It seems that these are very effective services for reducing harms with minimal adverse effects. Okay, next we have drug checking services, and these services are something that I'm very passionate about. So I have been volunteering with the Loop Australia since 2019. And the Loop Australia is a not-for-profit organisation that delivers drug checking services. So we have Australia's first drug checking service in Queensland, in Brisbane and Gold Coast, and we are about to launch services in Victoria as well. So drug checking is about providing analysis of substances to identify the contents and sometimes the purity of drugs using equipment. This one's called a Fourier transform infrared spectroscopy, FTIR machine. So you can see the picture at the bottom there of the equipment. People bring in a very small amount of their drugs. We put it on the machine, and then the machine is able to analyze it and tell people exactly what is in their drugs. This is very important. For example, we have nitazines, which are a new threat in Australia, very, very potent synthetic drugs that can cause overdose and death. So sometimes people are using, for example, heroin. They want to know, is it just heroin or does it have something else in it that makes it very dangerous? So that's where drug checking services are. I'll talk about the results in a second. So the aim of the service is to reduce risks associated with unknown substances. And then very important, another aim is to educate clients on safer drug use practices and educate the public about risky substances. So to me, the most important part of drug checking services is that it gives an opportunity to have a chat with somebody about their drug use. For most of these people, it's the first time they've ever spoken to a medical professional about their drug use. They don't understand the risks of mixing drugs. They don't understand the risk of mixing their medication that they take for depression with certain drugs. So it's a really important opportunity for harm reduction information. We are also then, if we find a drug that's got something dangerous in it, we can then release a public alert. So the whole community knows that this drug is particularly dangerous. So these services, there are a few fixed site services that are located with existing health services. So for example, in Brisbane, our drug checking service called Checkpoint is located at a health service that already existed before for people who use drugs. It already had a needle and syringe program and a doctor and a few other programs for people who use drugs. So that center is already trusted by people who use drugs. And now it's an extra service. They can come in and have their drugs checked as well. There's also a few temporary services at music festivals. So music festivals are a very popular location for drug use. A lot of people who go to music festivals take drugs. So that's why they like to have these services at the music festivals. So we did our first music festival in May last year. We had about 200 people from the festival come in and bring their drugs for us to test them. So the current services, the first service was in Canberra. It's called CanTest. And they have a fixed site in Canberra City Centre, and they also do temporary services at music festivals. Then we have our service, Checkpoint in Queensland. So we have our service in Brisbane and the Gold Coast, and then we do a few music festivals as well. And then we've just, the Victorian government has just allowed drug checking for the first time. So that service doesn't have a name yet. They've already done one music festival at the end of December, and the fixed site will be coming soon. And the New South Wales government has said that they will also be implementing drug checking very soon. So I find this a very interesting example of policy change, because when I started volunteering for the Loop 6 years ago, this was a very controversial idea. And we thought there's no ways that this is going to happen. The government will never allow this to happen. But over time, through sharing evidence with the government and policymakers, we were able to convince them to do a small trial. At the trial, there were 7 people whose drugs were found to have N-ethylpentalone, which is quite dangerous. And the government realized that those 7 people could have ended up in hospital or dead. So they saw the value of the service. And then from there, it slowly started to build a few more trials. And then Canberra allowed their service to open, and everyone sort of watched that service to see what would happen. And they realized it was a very good thing. And then it was resulting in positive outcomes. And that's why we now see the services are spreading. We now have services in Victoria, and soon we'll have services in New South Wales too. So here are the 4-month outcomes for Checkpoint, our service. This was the Brisbane service. So if we look at the results, we can see that 16% of people chose to throw away their drugs after finding out the results. So that's 16% of people who realized that actually I don't want to take this because it contains something that I don't want to take. And 23% said they would reduce their dose. So they were able to understand, so that's usually for MDMA or ecstasy. They were able to understand that that is a very pure drug and therefore much riskier than normal. So we were able to give them advice, you should rather just take half. And so they reduced their dose. Then we asked people, after the results, what are you going to do with the drugs? So as I said, there were people who disposed, people who said they take a smaller amount, and then a few people said that they don't have any more of this batch. This is one of the drug alerts that we put out recently about nitazines. Nitazines are very dangerous. They're a very highly potent synthetic opioid. This particular nitazine is 200 times more potent than morphine, much stronger than fentanyl, and a very, very small amount can result in an overdose and death. So this is a very dangerous thing to take. So these people bought these pills off the internet. They thought that they had bought oxycodone and then found out that their oxycodone actually had nitazines in it. So this was a really effective way to show the value of the service. These people threw their drugs away, and we potentially stopped them from having an overdose. So every time we pick up on a drug like this, we put out an alert that looks like this on our social media and the government health websites. So if anyone else has bought oxycodone that looks like that, they know that there's a high risk of nitazine in that tablet and they can be more careful. All right, so the next one to talk about is opioid agonist treatment. So this is medications like methadone or buprenorphine that are used to treat opioid dependence. So people who are dependent on opioids can use these instead of risky opioids. They can access opioid agonist treatment through clinics, pharmacies, and general practitioners. So I've got a table there at the bottom showing the different kinds of opioid agonist treatment and other information about it. And the benefits of this is that it can reduce opioid-related deaths and criminal activity because people are not engaging in criminal activity to try and get illegal opioids. It also helps to improve their physical and mental health. So for people who are dependent on opioids, this can be really life-saving treatment. Next is naloxone. So naloxone is a medication that helps to reverse opioid overdoses. And a few years ago, Australia introduced this new take-home naloxone program, which means that people can get it for free and without a prescription through the take-home naloxone program. So if you look at the map on the right, the purple dots show all the places where you can get free naloxone. So in other words, it's quite widespread. And we're trying to improve access so that everyone who needs it can have it. A lot of people just carry it around with them so that if they come across somebody who's had a drug or an opioid overdose, they can administer it. So it's available as a nasal spray, which is great. It's very easy to use, there's an injectable form as well. And you can get naloxone pretty much everywhere now. So hospitals, pharmacies, alcohol and other drug treatment centers, needle and syringe programs, drug checking services, and custodial release programs. So we really are trying to make sure that as many people as possible have naloxone in their bag, just in case they come across somebody who's had an overdose. All right, and then the last one to talk about is peer services. So this is just people who use drugs providing information and education to other people who use drugs. So often people who use drugs don't trust medical professionals. They are more likely to trust other people who use drugs because they can relate to each other. They know that there won't be stigma. So people who have used drugs then help volunteer at these services to be there in case somebody wants any information or education about their drug use. So there's a few examples of these services across Australia. So for example, we have Harm Reduction Victoria. In Queensland, we have the Queensland Injectors Voice for Advocacy and Action, so Quiver. They do a lot of amazing work. At music festivals, we have Conscious Nest, High Ground, and Dancewise. So they are at music festivals and they have, so you can see the picture at the bottom there of High Ground. They have information pamphlets on all different drugs. They have a big chart on the wall that shows drug interactions. So if someone's considering taking like ketamine and alcohol, they can see that that's a red block. So that's a bad idea. You probably shouldn't do that. And yeah, have a chat. They have naloxone on them. They have water, condoms, lollipops. And if you are at a music festival and you're having a bad time, if you've taken too much of a drug and you're not feeling well, they have a section at the back of their tent with beds and tea and coffee, and it's a quiet space. So if you want to just go and sit there for a bit to recover, rather than going to the medical tent. So these are really key services in linking to people who use drugs and providing them with information and education. Okay, I think I'll stop there. Thank you all very much, and I hope that there are a few questions.